We see a lot of patients that are interested in what we call full mouth reconstruction. They have extreme wear from years and years of clenching and grinding their teeth, or they have rapidly failing dentition from rampant tooth decay to other challenges. And so, where we always start is with a comprehensive exam. And what that means is we take full models to work up their case. Because where you always want to make sure you communicate well with a patient is to give them a very good idea of what that final restoration is going to look like. And you do that with either a physical wax up, where you wax up models to show them the restorations and what their shape and their shade and things like that look like, or you do, these days, we even do digital wax ups, where we can actually show a patient what things would look like with a digital record based on those same models. So when it's time to start having that conversation about a full mouth reconstruction, which means either recreating all of the tooth surfaces on the entire upper arch or the entire lower arch, or maybe both arches at the same time, you need to have all the questions answered before you start, and you need to have a really good idea of what that final restoration is going to look like. The tools that we use going into a full mouth reconstruction type case, believe it or not, the biggest tool necessary is developing a relationship with the patient. The relationship is the key. They have to know all of the things that are required. They need to understand what the appointments are going to feel like from the standpoint of the time involved and the investment involved. They need to understand what the restorations are going to look like. They need to have all of their questions answered. And so when you mention tools, what we mean is that we need to get models. We need to actually set those models on our articulator. We need to have a conversation about what those restorations are going to look like, so we understand that we can meet expectations and that they like what they're going to have at the time that we get finished. So the biggest tool in undergoing a full mouth reconstruction is developing that relationship with a patient, educating them on what's involved, and developing a clear understanding about what that result's going to look like.